medical, scientific, professional, academic. Welcome to Midpresso Podcast.
Hormonal Regulation and Circadian Sleep Rhythms in Aging. The authors of the article, Sleep in Normal Aging, describe the physiology and circadian sleep rhythms in the context of hormonal regulation during aging. The circadian system is an evolved biophysical and biochemical regulator of the human immune system, associated with the cyclic alternation of day and night, forming a normal 24-hour cycle. This ancient mechanism regulates several crucial physiological functions in humans: body temperature, heart rate, blood pressure, remodeling of bone tissue, sleep-wake cycle, rest-activity structure. The anatomical structure responsible for circadian rhythms is located in the anterior part of the hypothalamus and is called the suprachiasmatic nucleus, SCN. The regulation of circadian rhythms is achieved by receiving signals on the SCN from the eye's retina. SCN is the central endogenous circadian pacemaker of the 24-hour rhythm. The main functions of SCN include generation of circadian rhythms, control of melatonin secretion by the pineal gland, synchronization of all the body's biological clocks, decreased ability to adjust to phase shifting. Circadian rhythms become less stable with age, manifesting in a decrease in circadian amplitude and a reduction in the ability to adjust to phase shifting. For instance, in elderly individuals, the sleep schedule usually shifts to earlier hours, drowsiness appears earlier in the evening, and awakening occurs earlier in the morning. This phase shift is observed not only in the sleep-wake cycle but also in the cycles of body temperature fluctuation, melatonin and cortisol secretion, and they precede those cycles in young individuals by approximately 1 hour. Elderly individuals find it more challenging to adapt to phase shifts, such as shift work and changes in time zones. Consequently, older individuals require more time to recover after a phase shift. Reduced amplitude in circadian rhythms. Age-related reduction in circadian amplitude is associated with sleep disturbances. It has been observed that compared to young individuals, older people more frequently wake up when body temperature reaches its minimum. Additionally, the decrease in the amplitude of daytime activity also encourages daytime napping among the elderly. Age-related reduction in melatonin secretion amplitude also contributes to sleep problems. For instance, one study indicated that elderly individuals wake up 2.7 times more often than the young, suggesting desynchronization and a decrease in the amplitude of circadian rhythms. Sleep-related hormones. Hormones involved in sleep regulation include growth hormone, cortisol, prolactin, thyroid-stimulating hormone, TSH, melatonin, sex hormones. Growth hormone. The secretion of growth hormone peaks during adolescence, decreases geometrically from young to middle age, and then gradually declines in old age. Growth hormone secretion begins approximately an hour after falling asleep and decreases with brief awakenings. Suppression of growth hormone secretion leads to the stimulation of corticotropin secretion. Also, the age-related reduction in the nighttime level of growth hormone directly and indirectly influences the slow-wave sleep (SWS) phase, reducing the duration of this phase. Cortisol. Cortisol secretion exhibits a distinct circadian pattern, reaching its peak after morning awakening, gradually decreasing throughout the day, and reaching its minimum in the evening. Sleep suppresses cortisol secretion, and an increase in cortisol levels during sleep leads to awakenings. The circadian rhythm of cortisol release changes with age, manifesting in a reduction in amplitude, an increase in nighttime cortisol levels, consequently resulting in a decrease in SWS and frequent awakenings. Prolactin. There is insufficient evidence that prolactin directly influences sleep. However, it is well established that sleep affects prolactin secretion. Regardless of daytime or nighttime sleep, increased prolactin secretion is observed in the initial phase of sleep. With age, prolactin secretion decreases due to more superficial and fragmented sleep. The nighttime prolactin level in elderly individuals is significantly lower. Thyroid-stimulating hormone, TSH. TSH secretion also has a circadian pattern, maintaining a consistently low level during the day, starting to rise closer to the evening, peaking at bedtime, and then gradually decreasing during the night. The circadian secretion of TSH is preserved with age, although the overall TSH level is reduced. Melatonin. Melatonin levels depend on the dark and light periods of the day. Analysis of the 24-hour melatonin secretion profile demonstrated consistently low levels during the day, a progressive evening increase 2 hours before sleep, a consistently elevated level during the middle period of sleep, and a gradual decrease to daytime levels in the morning hours. The onset of evening sleepiness correlates with the increase in evening melatonin secretion. In elderly individuals, the reduction in melatonin secretion leads to sleep disturbances. Sex hormones. In men, testosterone levels gradually decrease after the age of 30. The decline in testosterone in older individuals is additionally associated with sleep fragmentation and shallow sleep. In women, aging involves a decrease in estradiol levels and an increase in follicle-stimulating hormone, FSH, levels. These processes are particularly pronounced during the perimenopausal period. In turn, changes in the secretion of female sex hormones contribute to complaints of difficulty falling asleep and maintaining sleep. Additionally, the reduction in endogenous estrogen and progesterone levels has a suppressive effect on the upper respiratory tract, increasing the frequency of respiratory movements during sleep. Risk factors for sleep disorders in the elderly. Most sleep parameters decline with age but remain unchanged after the age of 60. The described sleep changes apply to healthy older individuals and are often perceived as normal age-related changes. However, in everyday life, aging is associated with concomitant somatic and mental illnesses, reduced social activity, and lifestyle changes. All these factors contribute to sleep alterations. Thus, up to 60% of older individuals report a significant decrease in sleep quality. Therefore, sleep problems are not always solely related to age. Accompanying somatic and mental illnesses. The most common accompanying somatic illnesses in older individuals include osteoarthritis, cardiovascular pathology, lung diseases, gastroesophageal reflux, cancer, diabetes. Up to 67% of older individuals report some accompanying pathology. About 90% of people over 65 receive drug treatment, and over a third of them take more than 5 medications. Discomfort, side effects of taken medications, and emotional distress adversely affect sleep quality, increasing the number of awakenings. Common complaints of such patients include insomnia, sleep apnea, restless leg syndrome, a condition characterized by unpleasant sensations in the feet and calves during falling asleep, compelling constant movements to alleviate suffering. Depression, anxiety, and other psychiatric problems often manifest as insomnia. In turn, insomnia increases the risk of depression. Social factors impact on sleep. Although older people have a more flexible sleep schedule and may nap during the day to compensate for the lack of nighttime rest, factors such as reduced social activity and a sedentary lifestyle still contribute to sleep disturbances. Loss of loved ones, loneliness, loss of independence, and relocation to care facilities with additional assistance are significant stressors for aging individuals. Conclusion. Age-related changes impact sleep in various ways. Total sleep duration increases. Nighttime sleep duration decreases. Daytime sleep duration increases. Number of nighttime awakenings increases. Slow-wave sleep, SWS, duration decreases. Sleep remains relatively stable after the age of 60 in healthy individuals. Age-related changes in neuroendocrine functions correlate with alterations in sleep architecture during normal aging. Sleep disturbances in the elderly are influenced by somatic and mental comorbidities, reduced social activity, and changes in the environment. For details on the parameters